I'm Tim Cook with Ogden Clinic Marketing, here today with Dr. Brett Martindale, sports medicine physician at Ogden Clinic. I'm here to ask him about some of the recent changes made here at Ogden Clinic, including, Doc, there is now a sports medicine and ortho walk-in clinic now available in Ogden.
Yes, so we're hoping that people will be able to come in for injuries, whether they're sports related, recreational, occupational, whatever the type of injury they might sustained in just normal everyday life, and be able to see a specialist in orthopedics or sports medicine right away following an injury like that, as opposed to feeling like they need to go to the emergency room. So we're hoping that it saves people time and money, but that they also are able to get right into a specialist regarding their injury.
What is sports medicine? What conditions do you treat?
Sports medicine is a very broad specialty, and my personal specialty of sports medicine, as opposed to, say, orthopedics, you can kind of think of it as non-surgical orthopedics. So I don't do surgery, but we do all of the non-operative stuff that an orthopedic surgeon would otherwise do. And in those cases where people could need surgery for whatever their injury may be, we have ready access to orthopedic surgery right away. That being said, it's been said that 90 to 95% of all injuries that need to see a doctor will never need surgery. So that should also give people some comfort that they don't always need to race into the emergency room and spend all that time and money in a place like that, where they could get the care they need more quickly and for far cheaper with their insurance plans here in an outpatient clinic.
So with this walk-in clinic now available, what are the hours?
For now, it's going to be about 9 a.m. to 5 p.m. at the PCS, or the Professional Center South location in Ogden. Based on demand and when activities resume with this pandemic and such, we may be able to expand those hours. For now, it'll be 9 a.m. to 5 p.m., okay, Monday through Friday.
You also practice at our Caseville location sometimes as well?
Yes, I practice there on Tuesdays. A partner of mine practices there the other days of the week, and we're anticipating that things like this will be able to be available there as well, and be able to provide the same level of care with the same level of access to specialists and surgeons as needed.
What do patients need to do differently now during the COVID-19 pandemic than they would under normal circumstances?
Sure. I mean, there's a lot of stuff obviously out in the media and very good advice, and we're taking all the precautions that we can here in the clinic to keep patients and providers safe. We screen people at the door to make sure that they're not exhibiting any symptoms. We wear masks to try to prevent any potential spread of asymptomatic carriers. So we're trying to take all the precautions we can by still providing care that people need for their acute injuries.
What are the most common injuries that you treat?
Certainly simple things like twists and sprains and strains, so muscle aches, muscle pain. If you slip and fall and twist your ankle, we'd love to see just those injuries as opposed to people going into a more expensive or time-consuming place like the ER, but also fractures. Fractures are something that we can properly take care of most often in a clinic setting, even if it comes down to needing to set the fracture and such. Sometimes, on rare occasions, those do need to be seen in an emergency room setting, but oftentimes even fractures we can evaluate and treat properly here in the outpatient setting in the clinic.
Thanks again, Dr. Martindale. If you have any questions about Dr. Martindale or about sports medicine in general, visit our website at ogdenclinic.com.